do, I'm going to verify my provider orders in the MAR, make sure that a central line dressing change is appropriate for my patient. I'm going to gather all of my supplies. When I go in the room, knock, knock. Hi, my name is Ellie. I'm a student nurse from St. Martin's. Can you tell me your name and your date of birth? Awesome. I am here to do a dressing change on your central line. Is that okay? All right. Do you have any questions for me before I get started? Awesome. So I'm going to arrange my supplies nicely. I have my table that's going to be raised above waist height so I can maintain my sterile field. I would lay my patient down, but I can't really do that with our lovely Chester chest. So I'm going to leave him like this, but I would want him laying flat if at all possible. I'm going to make sure his bed is at a comfortable working height and that everything is laid out nicely. So first thing we do, hand hygiene. And also do hand hygiene when entering the room.
Yes. And then
hand hygiene. Clean gloves. Right. Are you having any pain at all or discomfort at your central line site? No. I'm going to make sure I stop the IV. If there was one running, he doesn't have one, so I don't do that. I'm going to be observing the site for any redness, swelling, signs of infection or infiltration. And I'm going to make sure I palpate it. All right, is that okay? Are you having any discomfort? No. I'm going to clamp. There's only one lumen, which is fantastic.
it should be realistically.
Next thing I'm going to do is I'm going to take off my gloves, open up my package, and get my mask for my patient to wear. He doesn't have a head, so I'm just going to set it behind him. All of my other supplies are prepped and ready to go. I'm going to reapply my gloves, hand hygiene first, and always. And reapply my clean gloves. I'm going to instruct my patient to turn their face away from the procedure, and I'm going to make sure I have a clean mask on as well. First thing I'm going to do is I'm going to take off the dressing. I want to make sure I'm stabilizing the access site. Where's my garbage can? So it's easier for me to reach. I'm going to stabilize the device while I'm taking off the dressing.
Before I do this? No. And now I'm going to do the top.
I'm gonna take off my gloves. Now that the dressing is off, I want to inspect the site one more time. Looking for redness, swelling, signs of infection or infiltration. If everything looks good, I'm going to move my gloves a little bit closer. Over my sterile gloves.
And I'm gonna open that. I'm gonna flush it forward and then do the pulsing. Pull back to make sure that there is blood. And then I'm gonna continue for 1 whole minute doing the pulsing. Remove it. And I'm gonna get your brand new.
And you'll want to say it too. And then I'm going to.
I'm gonna freeze that.
And make sure you stay still.
Make sure what?
Stable.
And in this, I also want to make sure when I'm looking at it that the sutures or whatever's holding it in place are intact, which they are.
And at the beginning.
So everything is intact. There weren't any steri strips on it, and no sutures or staples holding it in place. First thing I'm going to do is I'm going to take my antimicrobial. wipe. And I'm gonna wipe off any excess blood. If there's any gunk around the site, I wanna make sure I do that first. I don't wanna throw my scissors away, so. Next, I'm going to take my chlorhexidine swab. I'm gonna crack it. And then in up to a 3-inch area around the site, making sure I hold it carefully in place, I'm going to scrub for at least 30 seconds. Next thing I'm gonna do, don't throw this away. Next thing I'm gonna do is I'm gonna apply any skin protectant if I have it, which I don't. I'm gonna apply a stabilization device, which most of the time you're impregnated with some sort of antimicrobial medication, but I don't have a stabilization device, so I'm gonna skip that step. Next thing I'm gonna do is take my dressing. And apply it to the site. Making sure I can still see the actual point of insertion through the dressing. There we go. One of them. You gotta be kidding. I start something like this always There we go. Alrighty. I got that on there. I'm also gonna apply the bottom part, just to make sure it's extra secure. Alrighty. And I want to make sure I put my label on there also. So now that that's on there, the next thing I'm going to do, if my sterile gloves are still fairly clean, then not sterile anymore. As long as I don't have any gunk on them, I'm then going to take an alcohol wipe, and I'm going to make sure this is unclamped. Scrub the hub for 15 seconds. And next thing I'm going to do is I'm going to flush per hospital policy with either 3 milliliters of heparin or 3 milliliters of the normal saline. So there's my 15 seconds. Take my saline. Apply it. And I would flush 3 milliliters in short pulses. Which this could also, I swear, if I got it. Oh my gosh. I cannot get it off.
Do you need help?
Okay, so this is working. So what we're gonna do, I don't know what's up with this, but I would take off my saline. I would scrub the hub again for 15 seconds, and then I would attach another syringe of saline, But the next time, I'm gonna push it in 10 short pulses over a minute. I also want to make sure I aspirate for blood return before I do that to make sure the site stays patent, and I want to check for any signs of infiltration while I'm doing that. I'm then gonna scrub one more time, and then I'm gonna replace the sterile cap, which I'll figure this all out later. I'm gonna take off my gloves, hand hygiene. I'm gonna clean up my mess. I'm gonna put them back into a comfortable position. Make sure the bed rails are up. Call light is within reach. Clean up any excess equipment, garbage that I have. Alright, you have any questions for me? No, perfect. I will see you later. And